in parenting, in child rearing, in education very much, and certainly a problem in medical practice. Because what we're seeing these days, we have a lot of kids who are being diagnosed left, right, and center with all kinds of disorders. And a lot of parents are getting more and more perturbed about how to handle their children's behaviors. The North American response is one of two possible, not only possible, one of two main approaches. The first is behavioral. And the behavioral approach, we take the behavior and we don't like it, so we try to change it. How do you change the behavior? Well, how do you punish the kid for it? And then the idea is if you punish them enough, they won't behave that way anymore. Or we reward them for the good behavior. The idea being, if you reward them for the good behavior, then they're more likely to engage in that. Now, notice that in neither of these cases are we concerned with what's causing the behavior. We're just looking at the behavior. We like it or we don't like it. So we say, more of this, less of that. Here's the punishment. Here's the reward. That's the behavioral approach. Which gets us to Toronto in June of last year, where a 9-year-old kid was handcuffed in school. And what happened was that this kid had Asperger's, and he had, as a part of Asperger's, as the part of all of these childhood problems, is poor impulse control and lack of ability to read social cues. So this kid, because he's different, he's got Asperger's, he's bullied. That's what happens to these kids. They get bullied. ADHD kids get bullied more often. Asperger's kids get bullied more often. And bullying is a whole other subject. So he got really upset in the classroom. And he started yelling or screaming or something. The teachers thought that the best way to deal with this would be to lock him in a room by himself, which they did, at which point he totally lost it, proceeded to break up the furniture, at which point they called the cops. And the kid ends up in handcuffs, a 9-year-old, in a school, in this country. The debate afterwards was, did the police do the right thing in handcuffing the child? Which is, of course, a completely pointless debate and the wrong question. The right question is, because once you call the police, they're going to do what the police do, which is to restrain people. That's what they learn how to do. The right question is, why was the school so devoid of understanding of what this child behavior was all about that could only respond by trying to suppress the behavior? In other words, the school wasn't asking themselves. They had no understanding of what actually is going on in the brain of this child, poor impulse control, or what's upsetting him, and how to deal with an upset child. It's all about behavior control. So that's one approach. So, and it shows up very early in the parenting literature. If a 2-year-old doesn't behave, or a 3-year-old, what do? You banish him, time out. It's a pure behavior thing. You don't care what the kid is experiencing, feeling. You just want to control the behavior. But the essence of it is separation. And we do that a lot with kids. It's separation as a way of controlling behavior. Now the other approach, when the behavioral techniques fail, is to medicalize child conditions. So we have this whole panoply of childhood diagnoses. Of course, FASD, ADHD, Asperger's, Tourette's, conduct disorders, oppositional defiant disorder, pervasive developmental disorder, and so on. And being that we see them as medical problems, we also have a medical response to them, which is to medicate kids. We have 500,000 kids in the United States, many tens of thousands of Canada, including hundreds or thousands perhaps in this province, who are receiving heavy-duty antipsychotic medications, such as we give to adult schizophrenics. And these kids are not getting it because they're psychotic, they're getting it as means of behavior control. The side effects can be horrendous: weight gain, risk of diabetes, heart disease, acne, all kinds of stuff, personality changes, to the point where BC Children's Hospital has had to establish a clinic to deal with the side effects of the medication. Now the reality is that these antipsychotics have never been studied in children. We haven't got a clue what the long-term consequences will be on their brain development if they're given antipsychotics. I'm not talking about the stimulants for ADHD. I'm talking about the antipsychotics for behavior control. We don't have a clue what the long-term consequences will be. What we do know about the ADHD medications is that they don't seem to have negative consequences in the long term, but they also don't do any good in the long term. They help in short term, in behavior control and in focus, suppressing hyperactivity, but they do nothing for the child in the long term. But if it's a medical problem, we deal with it by means of a medical solution. The assumption, of course, is that we don't know what causes these behaviors, or if it's a medical problem, it's probably genetic. And most clinicians that deal with ADHD are still assuming that it's a genetic condition that you inherit. So, for example, I've been diagnosed with ADHD, which I have, as have a couple of my kids. There's the proof it's got to be genetic, passed it on genetically. Of course, both of these approaches look only at surface manifestations. The behaviors are not diseases, they're manifestations of an underlying problem. When you diagnose a kid with ADHD or Asperger's or Tourette's, you haven't explained anything. You've described something. You've described a set of behaviors or personality patterns that you can fit into a category. But it's not an explanation. You haven't said a thing as to why the kid's got the condition. You just described it. Now that may be helpful so that you have a general approach to the child. You know, you can describe the child and understand the pattern of his behaviors as, you know, belonging together into a spectrum or into some kind of a syndrome, but you have not explained it. And therefore, to try and change behaviors or to simply hand out medications is to fiddle with effects, but not to in any way have an impact on causes. So my intention here is to give you a perspective that encourages us and even allows us to deal with causes, not just the original cause of the child's condition, but the causes right now in his or her present situation. That perspective is called the Bio-Psychosocial perspective, which says that the biology of the child's brain and body is reflective of and is shaped by the emotional and psychological environment. So, I'm not saying that there isn't a biological problem here. Sure there is. If you do a study, for example, in Alberta, they looked at electroencephalograms, EEGs, which is a printout of the electrical activity of the child's brain, of adolescent males with ADHD. And they found that at rest, in a normal state, you compare the EEGs to kids without ADHD, there's no difference. But then when you give these kids a math problem, in the non-ADHD group, the frontal lobe of the brain, the front part here, shows increased fast wave activity. In other words, the brain is starting to do more work to solve the math problem. In the brain of the ADHD child, you have diminished activity. So instead of speeding up, the brain actually slows down. That's a biological effect. But the question is, what's causing it? Just because it's biological doesn't make it genetic. So it's not an issue, is it biological or not? The issue is what creates and influences the biology. And what I'm saying to you is that what creates and influences the biology is actually the environment. So, what I'm going to tell you here is about impulse control. Now, one of the traits, the ADHD's got three major traits, by the way, which are also salient traits of FASD, as you'll notice. For impulse control being one of them. And impulse control means just what it sounds like. Impulses are not thoughts that we consciously necessarily even aware of, or at least sometimes not till too late. Impulses are urges to behave, to do something, that arise from the lower brain centers. Now in kids with ADHD, FASD, Tourette's, Asperger's, Autism, conduct disorders, etc., there's poor impulse control. And, by the way, in what adults do you also have poor impulse control? Saliently. I mean, in many adults you do. But what adults specifically? Well, addicts, of course. You know, so that they'll do the thing that they know is not good for them because there's no impulse regulation. If you do brain scans on drug addicts, the commonest finding is that the part of the brain that's meant to regulate impulses just doesn't function. Which is why these childhood conditions of poor self-regulation and impulse control are such risk factors for addiction later on. ADHD is a significant risk factor for addiction in an adult. For that reason and for other reasons as well. So is FASD, of course.
Thank you for watching.